let's continue the discussion of degenerative disorders that affect the brain. The second one in the list after Alzheimer's would be Parkinson's disease. All right, what's Parkinson's disease? This is where there are loss of dopaminergic neurons. This is one set of dopaminergic neurons that are specifically located in the basal ganglia and also in the substantia nigra. All right, so what causes the damage to these neurons is where you want to talk about the damage to a particular structure called neurofilaments. So these are cytoskeletal structures that are damaged, which then damage one set of neurons. These are dopamine producing neurons, and therefore there is a decreased production of dopamine. Okay, what does dopamine do that would be lost because of this situation? Well, let's talk about the role of dopamine. You have to think about a particular movement. Let's say flexion. For flexion, there are two muscles used. One is the flexor that would be activated. The other muscle is the extensor that's inactivated. So flexor activation is through a stimulatory effect of acetylcholine. The inhibition of the extensor is through the release of dopamine. So for a good flexion, you need the activation of a flexor and the inactivation of an extensor. Activation is through acetylcholine, inactivation is through dopamine. Got it? So without the inhibition of the extensor, the flexion that's produced is not going to be a solid one. So it's not going to be a good flexion, is what I know you have to imagine. Okay, and so there are three typical symptoms here. You call this as three cardinal signs. Okay, triad. Those are one, tremor, and then rigidity, and then akinesia. That is no movement or bradykinesia. All right, the age group that's commonly affected is the older population, 65 years and above. So that's where it's 1 in 100 individuals, whereas in younger group, it is typically 1 in 1,000. A male suffers from Parkinson's disease a little bit more than a female. And this is the second most neurodegenerative disorder after Alzheimer's. And short life, it does shorten the lifetime. And then patients become increasingly frail, immobilized, and they may have trouble swallowing and may experience cognitive problems. Okay, so typically the early symptoms are seen in the proximal muscles of the neck. So what it does is, you know how you swing your arms when you're walking, that doesn't happen. Okay, and then the second thing is the lack of ability to rotate your head when you're turning your body. And then facial immobility is where infrequent blinking, that means you're not able to close the pupils as frequently, and positive emotional expression. So you are able to generate enough facial expressions. Then there is pill rolling tremor. That's where you have the alternating flexion extension of thumb and other fingers. That is mainly during resting, and when the person is moving, those are not commonly seen. Okay. Seborrhea is an itchy rash on the skin with white scales. If you see this in the head, that's exactly called dandruff. Then oily skin, spasms of the diaphragm, oculogeric crisis, that's the bilateral elevation of the gaze. So the person with Parkinson's would be looking up in one position for a length of time. Here is another additional set of details you would pick up. That is, the cause of the disease is mitochondrial dysfunction. Mitochondrial dysfunction, as we have discussed before, is due to oxidative stress. That's free radicals causing injury to the cell. And another detail here is loss of nerve growth factors, and then all of that leads to apoptosis. There may be a genetic involvement. It's about 15%. All right. So nigrostriatal dopaminergic neurodegeneration in basal ganglia are the ones that are mainly affected. There are different sets of dopaminergic neurons. This is the one that is commonly affected. Lewy body formation. What is that? That is proteins misfolding and accumulation of alpha-synuclein. So that is an abnormal protein that builds up within the cell. That is how you would see the degeneration, as well as from the mitochondrial malfunction. All right, so those are two events that are going on. One is genetic event, where you have the misfolding of a protein that causes the dopaminergic neurons to be affected. And another one is oxidative stress, mitochondrial dysfunction, and then the loss of these neurons. Okay, so decreased dopamine and decreased loss of muscle inhibition for muscle tone. All right, Lewy body dementia later in disease. Then unopposed cholinergic activity promotes muscle tone. Resting tremor, rigidity, bradykinesia, and akinesia are the common signs this patient exhibits. Good. So the progression is broken down into 5 stages here. In stage 0, there is no disease. Stage 1 is where initially it starts off on one side of the body, unilateral involvement. Okay, so you may just have tremor of one limb, a hand shaking on the time. Stage 2 is where one hand becomes both hands, bilateral involvement, both sides are affected. Balance is just fine. You can walk and do things normally, but you have tremors. All right, stage 3 is where stage 2 is getting worse. Stage 4 is where bilateral involvement with several postural instability, rigidity, and bradykinesia. So first it's tremor, then it is rigidity, then instability. So the postural instability is becoming obvious here because of the expansion of the muscles that are affected, and bradykinesia, obviously because of all that. Stage 5 is where situation is getting worse and the person may become immobile. All right, so now this is basically showing basal ganglia here and then substantia nigra here. These two are the ones that are affected by this condition. Here is a nice illustration of a healthy substantia nigra. You see the pigmentation here, that is not there in Parkinson's disease. Okay. treatment is discussed here briefly. Because this person doesn't have dopamine, now you have to give dopamine, replace this patient with dopamine. Because the blood-brain barrier is one situation, you have to look at lipid-soluble type of agent. So L-DOPA would qualify that, not dopamine. So L-DOPA is a precursor of dopamine. So that is what is given. All right. One thing you have to notice is L-DOPA or DOPA has a short half-life. So any interruption in therapy, okay, could bring the situation back. Okay, interruption in the therapy over 6 to 12 hours, loss of therapeutic effect is the risky situation here. So one has to be very careful with the timing of the treatment and remembering to take medication at regular intervals, right? So abrupt withdrawal of L-DOPA, skeletal muscle rigidity, interferes with ventilation is one thing that you should be aware of. And then L-DOPA sensitizes cardiovascular system and may cause arrhythmias. Okay, so that's another thing to be mindful of. Long-term therapy may lead to blood pressure fluctuations. Therefore, close monitoring is needed. Right. So this is where we stop this video. The next one would be multiple sclerosis. Thank you.